It's getting really bad.
Nearly everyone I know has like a nightmare story. People being turned away, people spending days in the emergency room.
The healthcare profiteers are these large corporations that view our human need as an avenue to squeeze pennies out of us. And if something's not profitable, they just shut it down. Every company that's involved in providing healthcare has made record profits through the entire pandemic while we're still dying. It's not just that we live in poverty amongst plenty, it's that our poverty provided them the plenty.
There's a healthcare crisis in America. In the so-called richest country in the world, the #1 cause of bankruptcy is medical debt. Pennsylvania has been hit hard by this crisis, where over 1 million Pennsylvanians are at risk of losing their Medicaid, and hospitals around the state are closing. I'm embedded with a group of activists that's fighting to end the rule of healthcare profiteers in the state of Pennsylvania.
Pennsylvania is a state where the national healthcare crisis can be seen clearly. First is the crisis of rural hospital closures. Across the country, 182 rural hospitals have closed since 2005. For-profit hospitals have only made things worse by closing any hospital that isn't turning a profit, which tend to be rural hospitals that serve poor people. The other crisis is the looming Medicaid cutoff, or the end of the federal health emergency, which stripped millions of people of their Medicaid coverage. Medicaid recipients across Pennsylvania are already beginning to receive notices in the mail that they might lose their health care. We started our journey in Johnstown, a city which consistently ranks as the poorest city in all of Pennsylvania. We met up with activists from Put People First PA, a statewide organization fighting to make healthcare a human right in the Keystone State.
The history of Johnstown pretty much is one industry after another coming in and leaving. And they've left us with no real entry-level jobs. I always thought, my future trajectory was get out of high school, go work at a laboring job, have a family, and that just never materialized because those don't exist here. At our height, I think we had 60,000 people and we're down to 19.
I've lived here my whole life. I was born in Lee Hospital. Things felt pretty good, and then my dad left, and my mom and her health was really bad. We were living off of about $800 a month at that point. And yeah, we didn't have hot water a lot or heating. Very cold winters. Her insurance wouldn't cover the medication she would need, which would have cost $1,000 a month. And we had to fundraise for it. We did. We got the money that they wouldn't give us to keep my mom alive. By the time she was able to get a liver transplant, they were rolling her down and she coughed, and they rolled her back up. She had pneumonia in both her lungs. Yeah, all that waiting for money. She passed away in December of 2021. We will die if we don't unite and, have the courage to fight against a system that doesn't care about our lives and cares about profits.
To get a better understanding of the scope of this crisis, we spoke with Nizhmi Zakia Zorinko, one of the co-founders of Put People First PA.
Yeah, so the federal health emergency is ending sometime this fall or potentially in the new year. And what that means is that Pennsylvania and many other states are going to start to kick people off the Medicaid rolls again. And up to 1 million people in Pennsylvania could be impacted. The initial estimates were 500,000, and then they went up to 1 million. And we have a state of 13 million people, so 1 million people is a significant number of folks. There's going to be more death. There's going to be more conditions that get worse because people can't catch them early enough. It's going to mean that folks are finding out and stressed out that they are being cut off and maybe not weren't even aware of it because they got a letter that they didn't pay attention to. There's a crisis of hospital closures. I mean, it's happening in urban areas, it's happening in rural areas. It's really happening wherever there are poor folks, especially folks who are on Medicaid. And those hospitals are not deemed profitable enough. And so the corporations or the private equity firms or the conglomerates that run them increasingly are shutting them down, just like they would shut down a GameStop, right, that isn't profitable. We're doing a study right now that sort of traces the rise of the University of Pittsburgh Medical Center and how it started with, he's no longer actually the CEO of UPMC, the University of Pittsburgh Medical Center, but in the 90s, I believe, when he became sort of the CEO of what became this behemoth, he literally told a group of people, we have turned healthcare from a public good into a commodity. He said this, and he was saying it as like, this is a victory, right? Like, we achieved it.
We wanted to see what this crisis looked like for ourselves, so we drove up to a town called Kingston where a for-profit hospital called First Hospital had recently announced it would be closing its doors. First Hospital is owned by Commonwealth Health, one of the largest for-profit healthcare companies in the country. Its closure will leave over 5,000 patients without medical care.
We didn't get in the hospital since 5 o'clock.
Yeah, what time is it?
It's 3:02.
It's 3:02 on a Thursday.
I don't understand why a hospital door is locked on a Thursday afternoon. Watch out for the pole.
So we could look on here, see the sign, it says they have the WIC Nutrition Center in this building.
Oh, it better be open, huh?
This is office operations.
Oh, you gotta be kidding.
No.
Nope. What if you're here and like you got a big old laceration on your arm and you need help?
There's a sign that says call 911.
But it's a hospital.
Exactly.
Help me out.
That same day, healthcare workers at Berwick Hospital were holding a rally to protest the closure of their hospital, another for-profit hospital owned by a rich couple that wanted to make money off of the hospital's medical services. When that vision didn't pan out, they announced that they'd be closing their doors on their patients.
Here, it's a couple that bought the hospital and bought several other hospitals, and I believe it was just in the last several years, and are no longer able to turn the profit that they want, and so they're selling it. And it's nothing more or less than capitalism.
It's terrible. You're no longer going to have a choice onto where you get to go, because of monopolies that are going to happen. It's no longer a free choice healthcare. You can't necessarily, depending on the insurance you have, is where you can go for a doctor. If you have a specific insurance that says no, you can only use these facilities. You're taking away people's rights. Their right to choose their healthcare.
The profit incentives that are driving this industry, do you think that's helping or hurting the provision of care to patients?
I think it's definitely hurting because it's taking away the actual objective to healthcare. When you turn anything into a profit, the focus gets skewed.
Berwick Hospital hadn't closed yet, but a quick look at the parking lot showed that it was going in the same direction as First Hospital. We went inside to take a look at what was left.
There's no one here. Completely empty.
So what do you do when a privately owned healthcare company decides that your community is too poor to have a hospital? What do you do when healthcare profiteers play God with your life? Well, you don't take it lying down.
The reason that they're able to get away with doing cuts for no reason and making the lives for poor people a lot worse and a lot harder is because they feel like they can get away with it. But if we're more organized and we have more people, then we're more likely to be able to have a way to stand up for ourselves.
Today we're going to be knocking on doors. Just want to recognize that this is the greatest opportunity for us to go directly to our base. Another goal for today is just being able to build relationships and learn from members of our class and how they're being impacted by this criminal health system. And we'll dig into this a bit when we go over the organizing conversations, but just want to emphasize that when we're out on the doors today, our key objective is to be the best listeners that we've ever been.
Yeah, no, he was a really good contact. He jumped right into talking about how what we need to do is unite as a class and, work to fight against the powers that be, and that was unprompted. We simply just asked him, what do you think needs to be done to make healthcare accessible to more people? And he literally was touching the survey and said stuff like this.
It was so
he was awesome. He was an awesome contact. We could have talked to him the whole time.
Later that week, Put People First was holding a people's health clinic at a community gathering in Evergreen Manor, a low-income community in Altoona where PPF had developed ties with the local residents.
What are you guys doing here today?
We're having a people's clinic, so we're offering blood pressure screenings and helping people sign up for government benefits like Medicaid and food stamps. We're not just helping people sign up, but we're also trying to get people to see we need a lot more than what they're giving us. It's just crumbs.
We're also giving them information about the upcoming Medicaid cutoffs, and we're asking them about their experience with the healthcare system. A lot of them are saying, oh, it's great, I've got Medicaid and I'm taken care of. Them not understanding that by fall, they could lose their coverage. Some of our members have already started to get letters about that. So if you are cut off, there are ways for you to appeal, and we can help you through that. We're getting to know the community and letting them know things that maybe they don't have access to information-wise. It also helps us learn how to help the next person as well.
Is it kind of tricky to navigate the Medicaid system in Pennsylvania?
Yeah, it is. And what we do, through training our members to do benefit sign-ups, is we get better at knowing what kinds of questions they ask that are meant just to deny you. Because there's tons of unnecessary questions on the application that if you enter the wrong thing, they'll use it against you.
I asked some of the members about whether or not they felt they'd be able to keep up with the number of people who might soon get kicked off of Medicaid, to which they all told me the same thing. They told me that there was no way they could hold enough people's health clinics to meet the scale of the crisis, and that their goal wasn't to replace the Medicaid system. Instead, their aim is to build a movement that asks why Medicaid is being stripped away in the first place. For Put People First, addressing the crisis starts with addressing the root of the problem, that a healthcare system motivated by profit will never put the health of the patient first, and that the only thing that could end the crisis was a movement of millions asserting that healthcare should no longer be a privilege of those who can afford it, but a fundamental human right.
There might be, a lot of people who watch this and think to themselves, this is great work. Public healthcare, that sounds like a wonderful idea, but that's never going to happen. What do you say to those people?
Who say public health care is never going to happen, I would tell them to look at 3/4 of the world. 3/4 of the world has public health care. 3/4 of the world has government-funded health care where people can walk in at any time and get seen without having to wait weeks for an appointment, without having to get all these referrals to see a specialist.
Before we've done anything, we didn't believe it was possible. I'm absolutely sure that people did not believe we could go to space before we went to space. We weren't able to go to the moon before we went to the moon. We live in a country full of skyscrapers. Nobody thought you could build those. I don't understand how we could possibly limit ourselves. We can do anything we decide to do. We just have to decide to do it.
Change is always going to happen. They're not going to hold power forever. The ruling class, they're not above being human. They're not above making mistakes, and they're not above being out-organized. But as the way things are now, they are out-organizing us, and it's because we're so divided. We're so afraid, and we don't work with each other, and that needs to change. Once that starts happening, there's no way we can be stopped.
There are mean things things happening in this land. There are mean things happening in this land. But the movement's going on, and the movement's growing strong. There are mean things happening in this land. There are mean things happening in this land. There are mean things happening in this land. Oh, the rich folks mustn't brag while the poor go in rags.